people don't know that this dental disease can kill, but we have seen some incidents here in Nairobi where a person has died because of a tooth. I'm called Dr. Samuel Ndeshimye. I'm the head of doctors at the Good Doctor Dental Practice. I'm a practicing dental surgeon, and I'm also specializing currently in one of the dentistry field called oral and maxillofacial surgery. I do my work here, and also the other time I'm at Kenyatta National Hospitals, where I currently do my attachment in oral and maxillofacial surgery. One important message that I can give to my people, early diagnosis, better is the outcome. So please don't wait for toothache to come and to start seeking for a dentist. When toothache has started, it's too late. Second, people don't know that this dental disease can kill. Oral health is very important because we say the mouth is like the mirror of the body. So whatever that is happening in your body, inside your body, I can have one or two signs from your mouth. So if the mouth oral health is hampered, it means even the overall in the body, things are not right. So second thing, it's oral health is very important in a matter that everything that is in your oral cavity, if it is affected, it will eventually affect your body. You will not perform well your work when you have toothache. In fact, in current studies, it has been seen that children who have good oral health, they perform better in schools. So it means there is this implication: how you take good care of your mouth, it reflects how fresh is your brain as well. Fear is there, for sure. It is there. Everyone who think of going to see a dentist, what comes first? Now, how am I going to handle this visit? But with current techniques and current practice of care, especially at the Good Doctor, our first priority is painless, pain-free treatments. So patient should be at his or her comfort area so that the treatments are not that traumatic in a way that you will fear to come back for another visit. So in the past, it used to be very traumatic, but with the advance in technology and also advance in care, we are seeing now we are coming out as doctors. In past, used not to be doctors. Probably people would have to go trained a few months, and they start taking care of teeth, they do dental extractions. This time you have to take your time. You take 6 years of medicine. You learn how to treat people, treat a person. Apart from knowing how to treat teeth, you are a doctor. You know how to approach person as holistic. So this time you have very many options, and also the technology has evolved from just injections. Now we have very painless injections. We have now introduced general anesthesia and also sedation in dental offices that we currently offer for people who have anxiety to come to dentist. So you shouldn't be fearing at this moment to come to a dentist, because it is no longer traumatic. Early diagnosis, better is the outcome. So please don't wait for toothache to come and to start seeking for a dentist. When toothache has started, it's too late. Second, people don't know that this dental disease can kill, but we have seen some incidents here in Nairobi where a person has died because of a tooth. It is not the first one. He's not the first one. Me as a surgeon, I see very many people like him. So most of patients, they come to hospital when it's too late. When we go, apart from toothache and dental infections, we talk about dental oral cancers. You have an ulcer in the mouth that has refused to heal. You are taking paracetamol, you are taking antibiotics, it is not going to work. Please seek care when it is a bit, it's still early, because when it is early, it is under control, so we can treat you. But when it's too late, the outcomes are not good. So be aware, go for dental checkup for at least twice a year. Brush your teeth twice a day. Brush at least 5 minutes and floss once before you sleep.
We educate the communities on the causes of dental fluorosis and how to prevent it. If I may talk a bit about dental fluorosis, usually it develops as a result of taking too much water with fluoride and also taking in a lot of food with fluoride. So basically it is when a person is young, not when you are old. So when you're old, you will not get dental fluorosis if you don't have it. But when a child is conceived, it starts at conception and progresses on to when the child is developing. So when the child takes in water with fluoride, a lot of fluoride, and also food with a lot of fluoride, it accumulates in the body and causes something called dental fluorosis and also skeletal fluorosis. So when that happens, the teeth, you notice the teeth discoloring, especially when they start falling off. When the baby teeth are formed, they are white in color, but they are not discolored. Then later on, the permanent teeth that grow in the mouth are the ones that become discolored. So in very severe cases, that is when you find the baby teeth being affected. But in not very severe cases, you'll just find the permanent teeth being affected. So preventive measure, if I may advise, would be incorporating something called water filter in our homes, whereby you will put the water filters in the taps that we use so that you can cook with water that is filtered and also drink water that is filtered. So that will help us prevent, because we don't know where this water is going through. So sometimes we may have clean water, yes, but by the time it reaches your homestead, you're not sure it's clean. So when it goes through the water purifier, it becomes safe for your family to take and also to cook with. It is very important for people to know when they should visit a dentist. A dentist is not visited when you have a dental problem. You should visit a dentist for dental checkups at least once or twice in a year. So it's recommended after every 6 months you come and visit a dentist, whether you have a problem or not, because sometimes you may have problems, but you don't know you have them. So when you visit a dentist for regular cleaning, that is one. The same way you take a car for service, you should take your mouth for service. So it's good for you to come. The doctor have a look, and then we clean the teeth. All the stains that are not out when you're brushing with your brush, we remove them. And then at least at that point, we'll be able to detect any issues that you may have before it gets worse, and we will be able to deal with them. The other thing is, it's very important for mothers to have education on oral health, especially when attending the antenatal clinics. So a baby as young as 4 months should be brushed. You should brush actually. We don't have teeth, yes, but you should clean the oral cavity, that is the mouth. So as soon as the baby finishes to take milk, that is suckling, you should take a clean cloth and clean the mouth. So that helps when the teeth starts erupting. They do not find a dirty surface. They find a clean surface. So I get a lot of questions, especially during teeth eruption, whereby mothers complain that when the teeth started coming out, they started coming out when they were black in color. And that is one of the major causes of something we call rampant caries, whereby teeth grow and then they start decaying immediately after they get into the mouth. And that's a very major problem. So mothers should be educated on how to clean the teeth even before the teeth get into the mouth, and immediately the first tooth appears, you should start brushing your child's teeth. That is as early as 6 months. So you should not wait until all the teeth are in the mouth so that you start brushing your teeth. You should start as early as the very first tooth. That is after like 6 months. Then don't do it for the child. You should train the child, and the best way to train, we usually say, monkey sees, monkey does. So when the child sees you brushing your teeth, that child will start imitating how you're doing it. If you don't know how to brush, then you will be teaching this child not to brush in the right way. So it's very important for you to be very sure that you actually know how to brush your teeth, for you to teach your kid.
For more stories on brand and businesses, like, share, comment, and subscribe on our page.